Yes, welcome back to lecture 2, where we look at classification of cancer, of course. So cancer can be classified according to the type of cells that they start from or they originate from. So we have the carcinoma is among the most frequently found forms of cancer. This one often appear on the skin tissues or in the organ lining, of course. Then we have the sarcoma. The sarcoma one can form in the bone, cartilage, fat, muscle structure within your body and should not be ignored as a potential risk, of course. We have leukemia on the other hand. Leukemia is a cancerous condition originating in the bone marrow that produces high number of abnormal white blood cells that accumulate over time, of course. Then lastly, we have lymphoma. So this cancer begins in the cells of the immune system, of course. So yeah, look at that. There are also some forms of treatment of cancer, or depending on the type of cancer that you're also treating. So each group contain various cancer conditions that require specific approaches for treatment. So we have radiotherapy, under which we have the EBRT and the brachytherapy. So EBRT is whereby the source of the radiation is normally located outside the patient, while for the case of brachytherapy, we normally move the source closer to the tumor or maybe into the tumor. So we also have chemotherapy, we have immunotherapy, we have surgery. So these are different forms of treatment depending on the stage and also the type of cancer that you are also treating. So the type of treatment usually depends on where the cancer is located. So the location of cancer is very, very important when you are choosing the treatment. And then the size of the cancer also, because you'll find that there are some cancers that may have reached a certain stage whereby even treating them become a problem. That's why it is always advisable that we normally go for screening as early as possible so that the cancer is found to be at its initial stages. Treating cancer at the initial stage is easy as compared to when the cancer has already grown. It normally reaches a point whereby now the cancer has reached a stage whereby we just do palliation. So palliative is whereby now we just reduce the pain. So radiotherapy is used mainly two ways to treat cancer. So you can either cure the cancer itself, okay, or you can do palliative or radiotherapy. So when you're treating, we destroy the visible tumor, which is definitive radiotherapy, sometimes with the aid of chemotherapy, of course, or we can combine with surgery for cure. Like for example, for neoadjuvant radiotherapy, this whereby we normally do radiation before the surgery. So the patient undergo radiotherapy first, and then it is followed by surgery. But for the case of adjuvant radiotherapy, this whereby immediately after the surgery has been done, the removal of the cancerous cells, then we do what is called now the radiation. So this one normally reduces the risk of recurrence from microscopic cells that might have been left behind to avoid metastasis. To reduce the second reason as to why we can as well do radiotherapy is to reduce symptoms that I'd already talked about, that is palliative radiotherapy. So this one normally shrink the tumor that are always affecting the quality of life, like lung tumor that is causing shortness of breath, okay, so that the patient is relieved. At the same time, we can also alleviate pain or bleeding by reducing the size of the tumor or inhibiting its growth. So that's why it's always advisable to go for screening. Going to screening does not mean that you have cancer because the feedback can either be negative or positive. So the earlier the better. The earlier the cancer is identified, the better for you. Yeah, so otherwise, that's the lecture for today. Thank you so much. If you have any question, always leave it at the comment section. Let's find it answered. In our next lecture, that is lecture 3, we look at treatment of cancer. Okay? Yes. Thank you so much.